Joining me on the news for more on World Malaria Day is the Director of Disease Control of the Lagos State Ministry of Health, Dr. Victoria Egunjobi. Good to have you join us.
Good evening, and thank you for having me.
So we see that Nigeria has made some sort of progress in reducing other disease burden, for example, polio. But why has the scourge of malaria lingered for so long?
I think the one thing about malaria is just beyond the fact that it's a health issue, it is an environmental issue. And there's no way you can say you want to solve the problem of malaria without having the environment that ensures that there are no breeding sites. It's something that's so common in our households. You find out that the gutters in front of the houses don't go. You have stagnant waters all around you. You have containers that serve as breeding sites. So the reality is, just like this year's team says, malaria ends with us. It requires every single household to make a commitment towards ensuring that we do end the scourge of malaria.
And what is the situation report for Lagos, especially now that malaria drugs and treatment costs have more than doubled?
Well, I think the good thing about malaria is that we can say over the years we've made significant progress. A few years ago, we had a prevalence of 15% with the commitment of the Lagos state government. And even up to right now, I must say that Mr. Governor, Mr. Babajide Sanwo-Olu, has given us a mandate between us and the Ministry of Environment to ensure that we kick out malaria. We've done significant work to ensure that we brought down the prevalence, you heard the Honorable Commissioner say it, to somewhere in the low transmission zone. What we just need to do further is ensure that we have enough recommitment from everybody, from the household to the policymakers, to say that what can we do to ensure we don't have malaria? And one thing that's fantastic about malaria is that it is preventable. So we want you to ensure that there are no breeding sites within your households. We want to ensure that you sleep inside your mosquito nets. We want you to also remember that not all fever is malaria. So we want you to get tested. And if you come down positive, and then you can then take anti-malarials. But one thing that we also know is that access to health insurance ensures that you're treated within the health benefit package of the health insurance. Malaria Eco is there. For a premium, you get treated, you get tested, you get treated. And what he also does is that he provides the opportunity for the health worker to explore what else that fever might be.
Dr. Victoria,
we've talked about the fact that...
apologies that I butted in, but I wanted to stay on because you said something about lifestyle and behavior change, how it begins with every household. And I'm wondering how you intend to drive that message. Lagos State is a state of about, or city of about, more than 20 million people. So how do you intend to drive that message?
So the World Malaria Day is just another opportunity that gives us the opportunity to talk to people within the communities. But on a day-to-day basis, the people working across the communities, within the health centers, within the hospitals, trying to spread out the word. We're going into households to say that breeding sites ensure you have mosquitoes. Use insecticide-treated nets. They're available for pregnant women and children who have completed immunizations in the primary healthcare centers. You have access to those. So it's really a behavioral change. And we know it's always hard, because people think, oh, it's malaria. I know what malaria is all about. But we then need people to understand that we're doing a lot of work, which is why the prevalence has reduced. But we just need to get to that level where we say we're now in the pre-elimination phase. And we need everybody, every single household, to get involved.
Thank you so much for your time.
Thank you.
Director of Disease Control, Lagos State Ministry of Health, Dr. Victoria Egunjobi.
Thank you for having me.
All right, we're staying on, excuse